Hello and welcome. You're watching Tracking the COVID-19, our special half-an-hour show in which we'll tell you all about the developments on the COVID-19 pandemic. We'll also get you the inputs about the steps taken by the administration and the global developments. All of that packed together in the next 30 minutes. Let's begin with the top updates. Home Ministry's guidelines for Lockdown 2.0 to allow select activities to resume after the assessment on the 20th. Health, agriculture, industrial units in rural areas and select utility services in the self-employed sectors may be allowed. Mass activities to remain prohibited. Face mask mandatory outside homes. Spitting made a punishable offence. The centre issues directives to states and union territories to tackle COVID-19, seeks strict implementation of all the steps related to the Lockdown 2.0 guidelines. The failure will mean no relaxation in the restrictions from the 20th of April. The Health Ministry says no community transmission of COVID-19 in the country so far. 170 hotspot and 207 non-hotspot districts identified. Door-to-door survey to be done in the hotspot areas. The number of active COVID-19 cases in the country now reaches 10,197 with 392 fatalities. Union Health Minister Dr. Harshvardhan holds a high-level video conference meeting with the World Health Organization officials. The minister says India has the lowest number of infected cases per million people in the world. WHO's polio surveillance team and other field staff joined COVID-19 fight in India. The External Affairs Ministry condemns United States Commission on International Religious Freedom spreading misguided reports on COVID-19 protocols followed in India, says the Commission must stop adding religious color to national fight against the virus. No religion-based segregation in the Gujarat hospitals. Government issues over 10 lakh refunds worth 4,000 to 50 crore rupees in a week to help taxpayers in COVID-19 pandemic situation. More refunds in the process of issuance this week. And WHO says it regrets US President's decision to stop contribution, even as Donald Trump accuses the organization of a tragic and horrible mistake in the early guidance. The global cases of COVID-19 crossed 2 million mark, death toll over 1,34,000. And first up on the show, let's take stock of the developments in India at Ground Zero. As Prime Minister Modi had announced during his lockdown extension address to the nation on Tuesday, the Home Ministry came out with a revised set of guidelines, the next day of which activities in which sectors will be permitted from the 20th of this month if the lockdown is strictly followed. And talking about those guidelines, first up in the health sector, and that includes all the hospitals, nursing homes, clinics, telemedicine facilities, dispensaries, chemists, pharmacies and all the medicine shops, including the Jan Aushadhi Kendras and the medical equipment shops. Also medical laboratories and collection centers, in fact, also to be functional, pharmaceutical and the medical research laboratories, institutions carrying out COVID-19 related research as well. And those functional in the agriculture sector includes the farming operations by the farmers and the farm workers in the field, agencies procuring agriculture products including the MSP operations, the APMC operated mandis or as notified by states or union territories. Also direct marketing operations by states or union territories or by industry directly from the farmers and the FPOs cooperatives. Decentralized marketing and procurement at village level to also be promoted. The shops of the agricultural machinery, spare parts and repairs to also function in the agriculture sector. That may be allowed. And talking about the transport sector, where all the goods traffic to be allowed, the transportation of goods by rail and parcel trains as well, airports and related facilities for cargo movement, relief and evacuation. Seaports and inland container depots for cargo transport, including authorized custom clearing and forwarding agents as well. Land ports for cross-land border transportation of the essential goods, and shores for truck repairs and dhabas on the highways. The movement of staff and contractual labor for permitted transport operations with passes from the local authorities. And those that could be functional in the private sector include the print and the electronic media, including broadcast, DTH and cable services, IT and IT-enabled services with up to 50% strength, data and call centers for government activities only, the government-approved common service centers at the Gram Panchayat level, also e-commerce companies and vehicles used by e-commerce operators with necessary permissions, including also the courier services and services provided by the self-employed persons like electrician, IT repairs, plumbers, motor mechanics and carpenters. And the enforceable national directives include the wearing of face cover that's compulsory in all the public and workplaces. Social distancing to also be ensured by in charges of all the public and workplaces and even in transport, and no gathering of 4 or more persons allowed anywhere. The district magistrate to also regulate gatherings like marriages and funerals. Spitting in public has been made punishable with fine, and strict ban continues on the sale of liquor, gutka and tobacco. The centre has also issued guidelines to states on the lockdown that is to be strictly followed. The centre has asked the states to ensure strict implementation of revised guidelines related to lockdown. The relaxation from the 20th to be withdrawn only if there's a failure that will be seen anywhere. And talking of the all India figures, well, the total number of positive cases now stands at 12,380, and out of these 10,477 cases are active. 1,488 have been cured or discharged, and there have been 414 fatalities so far. And the Union Health Minister Dr. Harshvardhan held a high-level meeting with the World Health Organization officials through video conferencing on the measures to tackle the COVID-19 infection across the country. Later, the minister also held a press conference and said the situation in the country is under control and India is in a better position than the rest of the world.
Incidence is per million the lowest in the whole world. It ranges between 4 to 8. At different times it has ranged like that. Although for many of these countries it is in few thousands, 2,000, 3,000, 1,000, like that. Right now we are quite well placed in the sense that we know our enemy. We also know where our enemy is. And the talk about these hotspots is, I think I must congratulate our surveillance people, our IDSP people, our WHO people, all those who are involved in this, and particularly all our state governments, that we have been able to pinpoint where the virus is right now.
And tapping into the best practices and key resources that helped India win its war against polio, the Ministry of Health and Family Welfare and the World Health Organization have initiated a systematic engagement of WHO's National Polio Surveillance Network and other field staff for the COVID-19 response. While addressing a high-level meeting with the WHO officials, the health minister said that with the combined meticulous work of the Government of India and the WHO, India got rid of polio. Dr. Harshvardhan called on the people on the front line as corona warriors. The regional director of the WHO Southeast Asia said that the National Polio Surveillance Project played a critical role in strengthening surveillance for polio cases that generated useful, timely and accurate data to guide policies. She also stressed upon the vital role of surveillance in making future strategies for containment of COVID-19. The project team will also support in sharing information and best practices and help the states and districts calibrate the response based on transmission scenarios and local capacities. Union Finance Minister Nirmala Sitharaman participated in the virtual session of the second G20 Finance Ministers and the Central Bank Governors meeting under the Saudi Arabian presidency on Wednesday to discuss the global economic outlook amid evolving COVID-19 pandemic crisis. India has disbursed financial assistance amounting to $3.9 billion to more than 320 million people. Also, policy measures undertaken by the Government of India, the Reserve Bank of India and other regulators have helped defreeze the market and catalyze the credit flows. The G20 preparing an action plan to safeguard people's jobs and incomes, restoring confidence, preserve financial stability and revive growth, also providing help to countries needing assistance, coordinating on the public health and financial measures and minimizing disruption to the global supply chain. In fact, the global community is also hoping to overcome this crisis soon, and the minister added that the lessons learned will enable us to develop prudent policy measures to combat any such crisis in the future. And the finance officials from the group of 20 major economies agreed to suspend the debt service payments for the world's poorest countries through the end of the year, a move quickly matched by a group of hundreds of private creditors. The decision was taken at a virtual conference. The actions to freeze both principal repayments and interest payments will free up to more than $20 billion for the countries to spend on improving their health systems and fighting the COVID-19 pandemic. And the World Bank Group President David Malpass and the IMF Managing Director Kristalina Georgieva have welcomed the decision of the G20 group of leading economies to suspend repayment of official bilateral credit of the poor countries. In a joint statement, they said this is a powerful, fast-acting initiative that will do much to safeguard the lives and the livelihoods of millions of the most vulnerable people. They further added that the World Bank Group and the IMF will move quickly to respond to the G20's request to support this action by working closely with these countries in ways that make the best use of the vital lifeline. Now, in response to a media query on a tweet on Wednesday by the United States Commission on International Religious Freedom on India, the official spokesperson Anurag Shrivastava said that the Commission must stop adding religious color to India's national goal of fighting the COVID-19 pandemic. He further dismissed the Commission's claim that COVID-19 patients in Ahmedabad hospital segregated based on religious identity. He also ensured that there is no segregation of COVID-19 patients in the civil hospital in Ahmedabad on religious lines. He's accused the Commission of spreading misguided reports and professional medical protocols followed to deal with the COVID-19 pandemic in India. Now, the prevention of the spread of COVID-19 pandemic is like the half battle won. Besides staying home and social distancing, digital technology is also proving a successful means to do so. An app like Arogya Setu is an innovative solution such helping making the population aware of the virus around them and taking timely precautions and saving many lives. Our correspondent Aisha Khanam gets us this report.
Made in India has caught the attention of the world fighting COVID-19 fiercely and vehemently using all means. Now, this app has come a handy app to assess the dangerous situation around you. I have with me Mariam, an engineer by profession, who has downloaded this app and seems to be checking out the updates on coronavirus disease. Hi Mariam, you have downloaded the Arogya Setu app.
Yes.
So how is it working for you?
The app is very simple to use. The toggles are very quick and it has lots of languages, which are official languages. So anybody can use it, right, from your kid to your elder, and it basically tells you things that you should be doing to maintain your safety.
Yes.
And this app is the government app,
Yeah.
so I know that the updates are all authentic.
So now a digital solution to keep yourself safe and also keep a distance from COVID-19 disease is a boon that Arogya Setu is providing to people. So Bangalore is known to kill any virus that enters the software system and finds a solution to kill the virus. So now a system, a software which can at least prevent the spread of corona virus is handy and helping people to mark themselves safe. Aisha Khanam, DD India, Bangalore.
So make sure you download Arogya Setu app if you haven't already done so. Let's now move on, take a look at some of the updates that inspire hope and positivity in tackling the COVID-19 outbreak. The Income Tax Department has issued over 10.2 lakh refunds worth 4,250 crore rupees within a week. The Central Board of Direct Taxes, the CBDT, announced this on Wednesday. The CBDT has stated that about 1.75 lakh more refunds are in the process of issuance in this week itself. Now, these refunds would get credited directly to the taxpayers' bank accounts in 5 to 7 business days from the issuance date. The Finance Ministry had last week said it will fast-track the issuance of pending income tax refunds up to 5 lakh rupees that will benefit around 14 lakh taxpayers to provide relief to the individuals and the businesses hit by the COVID-19 outbreak. In around 1.74 lakh cases, the email responses are awaited from taxpayers regarding reconciliation with their outstanding tax demand, for which a reminder email has been sent asking them to respond within 7 days so that the refund can be processed accordingly. Amidst the COVID-19 pandemic and nationwide lockdown, the hardest hit groups have been the migrant workers, the homeless, the poor and the disadvantaged. ISKCON, along with civil defense volunteers, is working round the clock to provide meals to them. More than 1,500 volunteers of the civil defense are working to provide food to more than 3.5 lakh people. The civil defense personnel have deputed their volunteers to food and other essential items to each and everyone so that no one remains hungry. Here's more in this report by correspondent Prasar Bharati.
Close to 3.5 lakh of meal every day is being provided by the ISKCON, and they have been distributed through the mechanism of civil defense personnel. They are providing 5 types of meal, basically 5 types of veggies as well as rice, puri, and all the necessary ingredients to keep people alive, keep people going at this particular time.
Civil defense here totally engaged with the kitchen personnel, with the ISKCON management on behalf of the Delhi administration, district administration, and civil defense personnel, all the cops, they are involved, everywhere they are involved, but here where we are is standing, here they are having the basically resource management, providing the items. Here all the storage is there. If you can see, there is a lot of storage. The civil defense personnel, they are maintaining social distancing among the workers because it is also mandatory for the safety point of view. And apart from that, there is the requirement of human resource.
Manning of the quarantine centers, manning and setting up of community kitchen, shelters. During the migrants' exodus, again the shelters and the food has been provided. The main issue is the community drives, awareness drives, which has been done by the civil defense volunteers. And most importantly, the collaborative work which we have seen between the ISKCON and the civil defense volunteers, this is just a very meager example of the effort which has been done by civil defense.
You can see amazing work by the ISKCON Temple Trust. They are not just providing the spiritual guidance to the people, but at the same time giving them food, giving them essential supplies, along with the civil defense personnel, are the backbone of this fight against the COVID-19. With cameraman Kumar Dutta, this is Taposh Bhattacharya, TD India, Delhi.
And in Jaipur, masks are also being made by the social activists every day to maintain the regular supply of masks amid the spread of COVID-19. In Jaipur's Senganer area, people are making over 50,000 free of cost homemade masks for health and sanitation workers and the police forces who are risking their own lives to make sure that you and I stay safe and we stay home. These are the Corona warriors, all of them, in fact, fighting together in these challenging times. And let's now scan through all the developments from across the globe in our segment, The World Wrap. Now, US President Donald Trump has said that he's finalizing the guidelines for several states to reopen their economies and will announce those measures today. He was speaking at the daily press briefing of the Coronavirus Task Force. Our US correspondent Jagruti Dave has more details.
President Trump said the coronavirus peak had passed in the United States and that he'd be talking to state governors to discuss the gradual reopening of their economies. He said that some states could reopen sooner than others depending on the level of infections in their states. And he said that some could even reopen before the May the 1st deadline. Earlier, the president had had a call with business leaders from various sectors ranging from retail to banking, financial services, hospitality, as well as other industries. Industry leaders had the opportunity to put forward their views on how the steps needed to be taken to reopen the US economy. And according to reports, industry leaders said to the president that virus testing needed to be ramped up before employees could safely return to work. At the briefing, the president also talked about his decision to freeze funding to the World Health Organization that he'd announced yesterday. He also repeated the attacks on the World Health Organization for what he described its mismanagement of the coronavirus outbreak. The president also threatened to adjourn Congress in order to fill vacancies in his administration, which he said it was very difficult to govern without them.
Now, the Maldivian President Ibrahim Mohamed Solih has made an emotional appeal for people to stay indoors following confirmation of the first COVID-19 case in the capital Malé. In an address, President Solih urged the public to treat each other with care and remain patient and assist each other according to the letter and spirit of the Islamic teachings. His appeal followed a person with no travel history testing positive in the congested Malé. The health authorities immediately announced a 24-hour lockdown in the capital, which may be extended. Maldivian president emphasized that work is underway to determine the source of the infection. He said 11 samples of direct contacts are being tested currently and contact tracing is underway in the Kashtu island, where a direct contact of the patient had recently traveled. Earlier, the 20 cases tested positive in the island nation were either among foreign tourists or people who had traveled abroad. And news now from back home. A new mother who tested positive of COVID-19, and while keeping the humanity alive, the two nurses of the hospital, I'm talking about AIMS here, they are taking care of her baby like his own mother. Take a look at those very touching visuals. These two nurses, they're leading by example of how all of us need to be the caregivers and nurturers of each other in this difficult time. The Ministry of Health and Family Welfare has released a video on the personal use of N95 masks. Let's take a look.
Hello everyone. This video is for the personal use of N95 masks being issued to all healthcare workers at AIMS New Delhi. You all have been provided with 5 N95 masks along with 5 brown covers, 4 small ones and 1 large cover. Place the 4 N95 masks in the 4 small brown covers provided and label the mask as well as the brown cover as 1, 2, 3 and 4. The 5th mask is being issued as a reserve. On day 1, before you come to duty, wear mask number 1 to work and wear it correctly, which is very important. After you return home from work, place it in the bag labeled 1 and let it dry. On day 2, wear mask number 2 to work and wear it correctly again. After you return home from work, place it in the bag number 2 and let it dry. Repeat the same for mask number 3 and mask number 4. The N95 mask number 1 is ready for reuse on day 5. For example, if you wore the mask on Monday, it is ready for reuse on Friday. All these 4 masks can be used for 5 times as recommended by CDC Atlanta, USA. They will be used up in 20 days. After 20 days, put all these 4 masks in the large brown cover provided to you and bring them to work and discard it in a yellow bin in your area. All these masks being issued for personal use will not be treated and reused. After 20 days, you will be issued a new set of N95 masks. The efficacy of these N95 masks have been verified by the specification committee. Stay safe, stay protected. Thank you.
It's a very important information there as far as the usage of N95 mask is concerned. With that, it's a wrap on this program tracking COVID-19, but all news and updates as far as coronavirus across the country is concerned. For the time being, it's a wrap. Thanks for being with us.